Hello everyone, so my persuasive speech will be on mental health and why we need more funding for it. In the United States, 46.4% are affected by mental illness. 16.5% of U.S. children between the ages of 6 and 17 suffer from mental health illness. Washington State has a population of approximately 7 million people. Close to 5.1% of adults live with serious mental health conditions. Mental illness affects many people, which leads to poverty, unemployment, then leads to depression, anxiety, poor self-esteem, and bipolar disorder. People with mental illness have faced discrimination in seeking employment and even being able to obtain housing. It also can lead to harassment, bullying, and even violence. Many people who are diagnosed or dealing with mental illness go untreated due to the lack of healthcare facilities, healthcare providers, and due to the cost. It also leads to drug usage, alcoholism, which then leads to homelessness and death. It can also start to affect our children. I propose a solution to this problem is by getting to know and understand the problem, understanding the problem of the person and their situation and the impacts of their mental health, which can be accomplished with more resource funding, more healthcare clinics that offer counseling services, and more affordable costs. Creating more support groups within the communities can make a difference. If you know someone who is dealing with depression or anxiety, give them support. Support can be just simply by reaching out and asking if they're doing well and being there for them. Starting a program or support group locally to reach out to anyone suffering depression and offering assistance and letting the individual know that they are not alone, it can make a tremendous impact on one's life. So you can start making a change now. It's as simple as reaching out and giving support and supporting our local communities that offer or are asking for resource funding. Clearly, having more quality in healthcare can be a critical link to helping people live more stable lives, including obtaining housing and maintaining employment and being happier. We should focus our attention on interventions directed at mental illness itself, such as rehabilitation and treatment programs for adults. Or would we be more successful by emphasizing treatment programs for young adolescents to prevent adulthood mental illness? If the United States has more research or education on how to deal with mental health, the percentage in the United States will drop. People will know how to cope with depression or anxiety better. They will not be codependent on medication or other drugs. Can avoid our children from mental health illness as well. If we don't come up with more resources or organization or healthcare clinics, then the potential consequences are a continually cycle. The number will gradually keep increasing throughout the years. Children will continue along the same path as their parents. Receiving encouragement, support, and friendship and understanding helps many people. I myself have suffered and experienced depression. And when I started receiving encouragement from people I didn't know, it made a huge impact in my life. I didn't feel alone or hopeless.